Thank you so much for that introduction, Angela, and it's a real pleasure to be here once again at this conference. And I stand as somebody who does not live with dementia, and therefore I feel very honoured and humbled to be amongst so many of you who are here today sharing your experiences, but together with so many other people in the audience who are dedicating your lives to actually truly make sure that people who are living with dementia, their carers and their families, get the services, the support and the recognition that they absolutely deserve. And that conversation about human rights goes to the heart of what I want to say in my remarks this morning. But Gina, I think if I'd heard you first, I might have changed the title to my speech this morning, because what you said about see through the dementia and don't lose sight of the person kind of really also completely underpins the things that I wanted to say this morning. So thank you for that. So what I wanted to just concentrate on in the few minutes that I've got is to think about the quality of the services that people with dementia, their carers and their families need to receive. And Angela reminded us in her opening remarks that there's lots of clever people, much cleverer than me, working very hard on cures and medication and all of those really important things. But critically, what happens when somebody gets a diagnosis of dementia? What support do they get? And what confidence can they have that the services and the support that they are going to receive is truly of the quality that matters to them and matters to those that love them? So I'm, as Angela says, from the Care Quality Commission. I'm not allowed to do a presentation without showing you this slide to remind you what it is that we're here for, which is to make sure that health and social care services provide people with safe, effective, compassionate, high quality care. And critically, we are here to encourage care services to improve. So that's an important kind of statement of our purpose. I like to translate it, though, into something a little bit more human, because actually, at the end of the day, this is all about the people who are using services, the people who love them. And I take that purpose for the Care Quality Commission and turn it into the mum test. This is not original. Other people have used the mum test in the past, but effectively, this is me saying to my inspectors, some of whom are in the audience, is this a service that you would be happy for your mum or anyone you love to use? And if it is, that's fantastic. We should celebrate it. And as Angela says, there's some amazing services out there with people doing great things, which we should be very positive about and recognise and value what they do. But if it's not a service that we would be happy for my mum or anybody else that I love to use, then we need to do something about it. And we ask 5 key questions of those services in terms of asking whether it's safe, whether it's caring, are people treated with the dignity and respect? Are their human rights respected? As I think we heard that call from the audience earlier. Is the service effective? Does it help people to live the independent, meaningful lives that they want to live? Is it responsive to people's needs? This is absolutely critical for people who are living with dementia, because those needs will change. The disease progresses, and we need to make sure that services recognise that, respond to that, and put in place the appropriate services. And we also need to make sure that the service is well led. And this is, I think, one of the absolutely critical aspects of the new way that we've been inspecting services over the last 2.5 years. Because we increasingly see that where you have great leaders who really care about the service that they're providing, about the people that they are supporting, that create a culture which is inclusive, that reaches out to the local community, that does indeed see through the dementia and remembers the person, those are services that are great. And the leadership of an individual service, and the wraparound environment for them is so critical. So those are the questions that we ask, and over 70% of services that we're rating in adult social care at the moment are being rated as good or outstanding. So we are seeing some great services, but frankly, as I said on the radio only this week, about 30% of services that are provided for people living with dementia in care homes are either requires improvement or inadequate, and that is simply not good enough, and we need to do something about it. So this is indeed my mum. For those of you who have not seen this photograph before, this is a photograph taken on my wedding day. She was pretty chuffed when I pulled it off because it took me 17 years to get David to marry me. So and what we want to make sure is that people who are living with dementia, people who are using services in adult social care, are as happy and as positive as my mum was on my wedding day. But I think, and again, this is one of the reasons why Gina's comments earlier were so important, I just wanted to concentrate on is how do we make sure that those services are actually of the quality that people who are living with dementia, their carers and their families want to have. And the way that we make sure is that we ask and we listen to the voices of the people who are using those services, their carers and families. I've been in this business for over 30 years in health and social care, but I don't live with dementia. I don't know what it's like. I have had some of that experiential training with the goggles and the gloves and the noise kind of going on around me. And I have to say it was a really impactful experience because I got so ratty with the people around me. And just having that experience of understanding that you really cannot control your feelings in the way that you'd want to was very powerful. But we need to make sure that we're listening to the people who are having that experience on a regular basis, understand what it is that enables them to live well with dementia and how we can do that. And we do have to respect the views and the opinions and the human rights of people who are using our services. We have to engage, and actually empower, I think, is an even better word than engage. Empower people to share their experiences with us and feel confident that they can do that. Because that's the way that we build up trust. And all of my experience in health and social care demonstrates to me that it's when you've got trust, when you've got trusting relationships between people who are using services and the people who are supporting them, that's when you can really, really make a difference. And that's when the intentions that we all have to do a good job action and turn into it actually being delivered. But one of the things that I just wanted to also kind of be clear about is that making a difference in the quality of services is not something that I, as the regulator, can do by myself. Clearly, as I'm sure you can see, and Andrea very, very kindly said, I am passionate about this. I really want to make it work, but I can't do it by myself as the regulator. It's absolutely critical that we are listening to the voice of people who are using services, their carers and families. That's something that we do within the work of CQC as well, with our experts by experience, and we have some in the audience as well today, who bring their own lived experience to the inspection activity that we undertake in care homes and in domiciliary care services, and indeed in hospitals as well. But we need to make sure that we're supporting staff, that they feel capable and confident in the job that they are doing. It can sometimes be a very difficult role that they are performing, and we need to value and recognise that the job that they do is so important. But it's critical that the people who are running these services create a culture and a set of expectations of their services, which mean that actually quality is what's going to happen. And commissioners and people who are funding services, they too need to think about what does quality mean in terms of making sure that people who are living with dementia get what they have every right to expect. And we, as regulators, need to make sure that we're setting clear expectations, checking up on those things, celebrating where there's the good care, but also taking action when there's not. But one of the things that I have been worried about in doing this job has been that we don't necessarily have a clear understanding across the whole of the adult social care sector about what quality is and how we can make it happen. So over the last 9 months or so, initiated by the previous Care Minister, Alistair Burt, a group of people, including people with lived experience of services, have been coming together to think about how can we create an ambition and a clarity around that ambition of the way that services need to be delivered so that they are of good quality. We can have a shared understanding of what that is, and we take collective action by using our partnerships with people who are using services, carers and families, as well as other organisations, so that we can see that improvement in quality, and people can have the confidence that when they're accessing a service, it's always going to be of a good quality, and it's not the kind of postcode lottery which the Independent Age Report using Care Quality Commission data highlighted this week. But one of the things that you know, and Angela's already highlighted this morning, is that I've concentrated very much on adult social care this morning because, frankly, that's my job. But actually, that's not the way that people live their lives. People living with dementia will be experiencing support from adult social care and the health service. And we need to make sure that we are working together across those divides. And it's over 3 years now since we published our report on the experience of people living with dementia who move from care homes into hospital and back into care homes. And given that we called it cracks in the pathway, I think you've kind of probably worked out what our major message was, that people were experiencing breakdowns in communication, sharing of information, and we need to make sure that we do better around that. So aligning our shared view of quality across health and social care is so very important. And finally, we need to learn from the best. There is some great care out there, and there are some wonderfully passionate people who are delivering that care. And there are some really key characteristics, and I'm not going to go through every single one of these points, but absolutely people are creative and innovative. They're open about what they're doing. They're looking to improve. They're doing this for the people that they're supporting, not for me as the regulator. And, absolutely, they are focusing on person-centred, high-quality care for all. And that's what they're there for, and that indeed is what we at the Care Quality Commission are there for too. Thank you very much.